Taking stock of a bad flu season that may be getting worse. Earlier this month, a 51-year-old mother of two from Needham, Jenny Ching, died just days after she was diagnosed. Since the start of the season in October, the flu has been widespread in nearly every state, and this year's dominant strain seems to be especially nasty. The Centers for Disease Control and Prevention report there have been close to 9,000 hospitalizations so far and more than 1,200 deaths associated with the flu, including 30 children. Ominous numbers, but how different is this year, and what is the best way to stay healthy? Joining me now are Dr. Paul Biddinger, head of the Center for Disaster Medicine and an emergency medicine doctor at Mass General Hospital, and Dr. Graham Snyder, associate hospital epidemiologist at Beth Israel Deaconess Medical Center. Thank you both for being here.
Thank you.
Can you both start out by helping me figure out how bad things actually are this year? Because I've seen a split in coverage, with some stories suggesting this is a really, really bad year, and others saying, well, this is sort of par for the course. So which is it?
I think so far we don't know, and that's one of the tricks of the flu season is you don't know really until it's over. Some features are definitely worse than what we've seen in previous years. It started earlier. The fact that it's widespread in 49 of 50 states is almost unprecedented, and we're on track to be probably even with some of the worst years in the last decade. We don't know yet that it is a historically bad flu season, but certainly it's one to take very seriously.
When you say we're on track to be even with some of the worst seasons in the past decade, are we talking fatality count? Is that the ultimate metric, or is it something else?
Well, this is what we're talking about is a epidemic seasonally. Every season we have an epidemic of these flu viruses. And the number of deaths, which is one sad metric, can range in the tens of thousands, from 10,000 to 50,000, 80,000. This season, it's a moderately severe season. And so that means we'll be in the tens of thousands with deaths. But the other complications are hospitalizations, lost sick times. There's a lot of issues that may relate to the flu and the impact on our society.
The Globe reported a couple days ago that you guys at MGH were, I think, both because of the severity of this season so far and because of supply issues connected with Puerto Rico and what they've been through, that you had to administer Gatorade to patients who could handle it because there weren't enough IVs to go around. Is that still the case?
That is still the case. The shortage really has to do with Puerto Rico and Hurricane Maria. About 40% of the whole country's IV fluid manufacturing was in Puerto Rico and was taken offline back in the end of September. Since that time, hospitals across the whole country have been suffering a shortage of IV fluids. And what we've been forced to do is, if people can take fluids by mouth, we give them fluids that way. Instead of water, sometimes people need sugar, salt, we give Gatorade or some other fluid. If people need IV fluids, they still do get it, and that's an important thing to run.
Are you guys coping with similar issues at Beth Israel, or is that not a problem for you right now?
Well, we're dealing with the same issues. We're not coping with Gatorade necessarily, but we are managing very carefully our IV fluid supply. In the bigger scheme of things, drug shortages are increasingly prevalent as a problem. Fortunately, this year, we're not seeing a shortage in oseltamivir, or Tamiflu is the brand name, the main drug to treat influenza with, so that's not a concern we're facing yet. But I think that the IV fluid shortage is just a symptom of a larger issue that we're dealing with flu and non-flu issues every day.
My understanding, and tell me if I'm wrong here, is that the dominant strain this year is H3N2, and that a big problem is that the current iteration of the vaccine doesn't really hold up well when it comes to H3N2. I've seen different numbers. I've seen 10% efficacy. I've seen up to 30% as an estimate. Let me step back a bit. How effective is this vaccine against H3N2, the dominant strain? And when we talk about effectiveness, we're talking about total protection, partial protection, mitigation of symptoms if you get sick. What should I be thinking about?
The vaccine does two important things for us. It prevents you from getting the flu, and that's what we talk about when we say vaccine efficacy or effectiveness. And if you have gotten the vaccine and end up becoming sick with the flu, it can reduce the risk that you have serious complications. So it does two important things for us. The seasonal epidemic of flu every year is not just one virus, it's a mix of flu viruses. Influenza A viruses, influenza B viruses. And H3N2 refers to one specific strain of influenza A. There's a couple things that make H3N2 a little different, and all of these strains are different because the way they interact with our body, their ability to cause infection are a little different. There are a couple things that make H3N2 a little different. Historically, it's been more likely to cause serious complications than other strains. And historically, the vaccine has not been quite as efficacious. And so the 10% was reported from Australia, specific for H3N2. And then the 34, 33% from Australia has been for the vaccine overall.
Got it.
we'll have to see this year if we see those same percent efficacies in the U.S. population.
But I think the most important thing to remember, as Dr. Snyder is suggesting, is the flu vaccine is still one of the most important things you can do. Even if it doesn't prevent you getting the flu, there's really good science that says it actually makes you less likely to die. Important landmark study from last year that shows that in children, it decreases their risk of dying even if they still get the flu. And so I know people love to focus on whether it's preventing the flu, but it's one of the most important things you can do to really protect yourself from the serious consequences.
I'm actually really glad you brought that up because I have a friend, I'm not going to name him on TV because I only want to shame him a little bit, not as much as I could, but I have seen him crow, he doesn't get the flu shot, and I've seen him crow about his decision not to get it when reports are out about diminished efficacy on a given year. So I think, I was going to ask you what case you would make to someone like that. I think you just made it. If you're less likely to die, that's
I think that's exactly right. People get worried, and it's okay to get worried because flu is a serious illness. Again, as was mentioned, every year we don't know exactly how many people die until the season's over, but it's on the par with how many people die in the entire country in car accidents every year. So it's a big number, and it's one of the most important things you do to stay healthy. I think the important thing is that most of the myths people think about with the flu vaccine are really just that. They're myths. You cannot get the flu from the flu vaccine. It doesn't make you sick. And, people still say that a lot, even in the hospital setting. And one of the things of course, we're doctors, but we try and dispel that myth as much as we can.
All right, so there's an exhortation to people who are skeptical of the vaccine and maybe have chosen not to get it. What would you say to people, again, I'm thinking one person in particular, not going to name any names on here, people who insist on showing up at work or going to sort of crowded social gatherings, even though they might say they think they might be coming down with the flu. I guess in the case of work, frequently it's to show what a trooper you are, that you care enough to be there. What would you say to those people?
The term we use in the medical field is presenteeism, people showing up when they're ill. And it's important for the flu, it's important for other respiratory viruses. I think after the vaccine, the second important thing to do is be kind to our neighbors. And so by not transmitting. So this means covering your cough or sneeze with your elbow or using a tissue, hand hygiene so you avoid either picking it up or transmitting it to surfaces, and not showing up to work. Hopefully bosses have come to the point where they understand that one employee out for a few days or a little bit longer is much better than transmitting it to the whole office and having the whole cycle go by.
I really hope so. Anthony Fauci, who is the head of the, I'm going to get it wrong,
National Institute of Allergy and Infectious Disease.
Thank you for saving me.
No
he recently made the case, and I don't think this is a new argument, that it is high time to stop creating flu vaccines the way we do. And this is too complex for me to fully wrap my brain around, but I know right now we use chicken eggs to incubate or to create new strains of the flu vaccine. It can be done in other ways. Insect cells, correct? There's also this dream of a universal vaccine. How close are we to significantly changing for the better the way we do flu vaccines? And could this year be an impetus?
Well, I think it's really important we get a new way to make flu vaccine. I think part of why it's so hard for us some years to have the vaccine match the strains of circulating flu is that we have to plan almost 9 months ahead. That the vast majority of vaccine is still grown in chicken eggs, so we have to order the chickens to lay the eggs, to inoculate them, and we guess the 3 or 4 strains we think are going to be circulating and have to start growing. It's a very long process. Modern technology allows us to shorten that window, make more vaccine, be much more targeted at what the circulating strains are. But ultimately, really, the most important thing we need to actually dedicate dollars to is finding a universal flu vaccine. That's so much more easily said than done. Flu is one of the most changeable viruses there is. That's why you need a flu vaccine every single year, because the virus keeps changing. Ultimately, it is still influenza, and what we're really hoping is that we can make some breakthroughs in science to have one vaccine that protects you for a much longer period of time. We're not as close as we'd like to be.
I'm going to ask you the last question. Short answer only, please, but I got to bring this up. I've seen some indication that at least some practitioners are dissatisfied with the way President Trump's CDC has approached this flu season. Have you seen any meaningful difference between the way business has been done this year and the way it was done, say, 5 years ago?
The CDC provides a really valuable service by taking data from local and state reporting for flu and giving it to practitioners like ourselves to help prepare for the season. Haven't seen a change in that practice at all. It's still really important. What we'll have to wait to see is any changes in funding for future research, like vaccine research. I think that would have a big impact, a big negative impact on the flu.
Okay, Dr. Graham Snyder, Dr. Paul Biddinger, thank you both.
Thank you.